Welcome, my dear friends, once again. Today, on the 6th of December 2023, when the Kaumarbhritya tantra class was going on regarding the development milestones in the children, unfortunately, due to the technical problem, there was interruption, and there was naturally we have to divide that particular things. And so today's lecture will be in having two parts. For example, A part and the B part, but the contents will be a little bit more same time. Okay, so we have discussed about the fourth year, that is names. That means we are discussing some people who are seeing this video directly, let them have the clear-cut idea what we are talking right now. I am telling you that Professor Deshpande, when was taking the lecture on the 6th of December 2023, Kaumarbhritya Tantra, due to the technical difficulty, there was a breakup in the continuation. And so on this date, I have the two videos with the same topic. That means assessment of development of the baby after birth, what will happen after second month, after third month, after 6 months, that we have discussed. Fine motor skill development, this we have already discussed, because some people may be seeing this video directly, so they get shocked. Sir, you have not covered previous. My dear friend, that will be the part A. I have already, this is the part B of today's video. So be clear cut, having the idea in your mind. Fine motor skill development, gross motor skill development, social or emotional development, everything is there in the previous video. Language development and cognitive development. So we have discussed in fine motor skill development. I am not going to repeat everything, but just to give the idea, when the child will start grasping, when will reaching out for the object, transferring the object, etc. Then we have discussed gross motor skill, especially sitting, walking, running, climbing upstairs. Then we talk about the social and emotional development, saying the bye-bye and knowing the gender and name. Then also language. We have talked about a lot about, for example, monosyllabi, bisyllabi, etc. Then we talk about the cognitive functions. And here, I think we have nearly at the last part of the printed matter. The class is not over, my dear friends. Please see this video up to the end, because I am after this last two things, I am going to give the very interesting dictation for the two important diseases. That is the specialty of the today's lecture. Although that diseases are already discussed with my different videos, but still I will go into the details and give you the proper dictation, because they are related with the milestones. Okay, just wait. This video will be short of 20 minutes, no problem. So fourth year, name some colors, which is a red color, which is a yellow color. So he will understand, baby will understand. And some numbers also. What is this number? How many fingers are there? He or she will say 5. Okay, then counts 10 or more things. Count is my fingers. So at the age of 5 years, he will count all the 10 fingers very easily. Know about the things used every day. The toothbrush, show me your toothbrush, show me your shoes. So he can immediately identify. Show me your shirt, show me your trouser. So everything show me your comb, show me your face powder. Everything he or she will easily tell you. Then copies a triangle and other shapes. So he can easily draw the different circles and the six hexagon and all these things. Okay, so these are the discussions about the milestones. So taking the screen up and keeping you aware that what we have learned in this today's lecture, I am going to give you which is the disease when the child has a delayed milestones. So there are actually one disease is more important, which is called as a Marasmus. Now this is the dictation. 5 minutes for each disease. I am giving you the dictation for two diseases. At some time, if the time permits, I will come again with some what you can say, the literature in front of you. But at the moment, I am giving you the audio dictation. So write down Marasmus, Marasmus. This is the name of the disease, Marasmus. And second disease, if the time permits, is Kwashiorkor. Please write down the names. First, Marasmus. Is it okay? Marasmus. Then Kwashiorkor. This is asked in the examination. Kwashi. Kwashior. Kwashiorkor. Kor. Kwashiorkor. These are, both the diseases are the examples of, please write down, nutritional deficiencies or undernourishment. Please write down. Apatarpanajanya vyadhi in Ayurveda. Dhatu kshayjanya vata prakop will be there. All the things you don't write, but listen. Apatarpanajanya, that is undernourishment, deficiency of nutrients. So first we will start with marasmus. Marasmus is called as, write down, protein and calorie, both. Calorie means carbohydrates. Protein and calorie malnutrition. Protein and calorie. Calorie means both carbohydrates and fats. They are giving energy. One is a direct energy, fat is a stored energy. So here, protein, carbohydrate, fats, everything is less. That is marasmus. In Kwashiorkor, only protein deficiency. Only protein. Kwashiorkor, only protein. Marasmus, protein, carbohydrate, fats, less. And because of that, there will be weight loss. Very, very less weight of the baby. That is infantile wasting. Infantile. As much as you can write. Otherwise, afterwards you hear and write down. Okay. Wasting. W-A-S-T-I-N-G. W-A-S-T-I-N-G. What is wasting? Thin. Very, 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 very thin. Loss of fat from the body. Loss of muscles. Because proteins are taking care of muscles. Fats is taking care of your fat. So everything is lost. And child become like this. Can you see my finger? Very, very, very thin. That is wasting, weight loss. So I will tell you the definition. Don't write it. Now just here. I will tell you when to write. Okay. So there is a condition of wasting in infancy after immediately 1 month, 2 months, 6 months, usually arising from, many times it is because of some reasons, secondary disease, or sometimes no cause, that is idiopathic. Idiopathic means no definite cause is found. Okay. So I will now give you the list of etiology. Don't write, just listen. Causes, etiology. Number 1, idiopathic, that you write. I-D-I-O-P-A-T-H-I-C. Idiopathic means cause not known. Idiopathic means cause not known. Write down. I will wait. Idiopathic. Okay. Second cause. Second. Write down. Insufficient feeding. Breast milk not proper. Less milk. No milk. Starvation. Okay. Insufficient feeding. This is another cause. Then deficiency diseases. Important. Write down. Deficiency diseases. For example, chronic starvation. Poverty is a big problem. No money. How laborer, how they can take the care of child? That is called as a chronic starvation. No food, comma, avitaminosis. Vitamin deficiency, avitaminosis, and also Kwashiorkor. So these are the different deficiency diseases. You have written that. Now, no writing, only hearing. Causes. Sometimes the child is suffering from some infections. So infection is one of the cause. Next, sometimes digestive problems. Digestive problems. For example, child cannot eat properly. Take the sucking of breast milk is not popular. Cleft palate or cleft lip. Please write down. C-L-E-F-T. I am showing here. Cut. Cleft lip or cleft palate. Cleft lip or cleft palate. This is important. Write down. Cleft palate. That's why the baby cannot suck. Sucking problem is there, and the child will starvation because of this structural problem. That is important. Now just here. Next is a Heart problem. There may be congenital heart problem. Next cause, renal problem, kidney problems may be there. Then metabolic disorders, juvenile diabetes. Yes, in the child also from birth it can happen. Very rare, but can happen. Then there is a hypothyroidism, thyroid problem. Yes, in the children also. Very rare, but yes, it can happen. And neurological diseases, brain problem like meningitis, mental retardation. These can be the different causes for marasmus. Okay. Now, we have to write down symptoms. Here, not only hearing, you have to write down. First symptom you write down. First important, weight is less. As per expectation, weight will be less. Low weight, first month, second month, 6 months, weight will be less. Okay. Then next is next will be the development. These milestones are retarded. Milestone will be delayed. Please write down. Milestones will be write down. Milestones will be delayed. In which disease? Marasmus. Dr. Deshpande is talking marasmus. Child is very, very thin. Protein, calorie, malnutrition. Third symptom, please write down. Loss of subcutaneous fat. Below skin, there is a fat. It will be lost. Okay. Then there will be wrinkling of the skin. Like here, wrinkling. Marathi मध्ये आम्ही त्याला सुरकुत्या म्हणतो. Wrinkles everywhere in the body. And because of that, his face, the child face, is look like old man. Child will look like old person. That is very important sign. Write down there important. And that sign is called as a monkey facies. 3 times I will say this word. MONKEY. Monkey facies. FACIES. Face. Monkey face. It looks like monkey face. Monkey face. Remember this sign. Marasmus. Monkey face. Marasmus. Monkey face. Marasmus. Don't forget it. Then your muscles hypotonic. Less hypotonic. Then that child having the skin, all the child will be cold. Body temperature will be less because fat is not there. Body temperature will be less. And most important, crying all the time. Crying. CRY, crying. The child will be irritable, crying. Okay. Then eyes. Eyes are sunken. Inside, eyes are sunken. This anterior fontanelle, anterior fontanelle, FONTANELLE, anterior fontanelle, depressed. Anterior fontanelle, depressed. And recurrent infections. Immunity will be low. Recurrent infection. I have given you the best idea of the disease, marasmus. Protein, calorie, malnutrition, milestones are delayed. Very interesting. Okay. You make a notes. Treatment, what will be the general treatment? First, you have to try to, if the cardiac problem, treat the heart. Renal problem, treat the kidney. So original cause can be found out. But then, if only because of the starvation, you must take care proximal principles of food. Please write down proximal, PROXIMAL, principles of food should be given. Proteins, fats, carbohydrates, vitamins, and minerals. All these supplements should be given. You have to calculate how much calorie, very important. CALORIE, calorie requirement, you have to calculate. Simple. Weight in kg multiplied by 100. Weight in kg, that baby, multiplied by 100, that much calorie. Okay. Milk or milk substitutes should be given. Then generally you can give the boiled rice, vegetables, fish. These things should be given. And every 15 days, you have to record the height and weight. Height and weight chart is very important. And this is about the marasmus. Now, 5 minutes for another disease, Kwashiorkor. You make the end line. Next topic, take a dictation. Kwashiorkor. 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 Protein malnutrition. Protein malnutrition. Okay. When it is occurring? From 10 months to 4 years. Anytime this can happen. From 10 months to 4 years. Okay. Then there is deficiencies like dietic deficiency. Sometimes worms will be there in the abdomen, so it can happen. So what are the symptoms or the clinical features? Just here. After few weeks of starvation of the breast milk, the child will become anorexia will develop. Anorexia, loss of appetite. Temperature is changed. Height and weight will be low than the average standard. But the most important, this symptom you write down. You write down for Kwashiorkor, edema is important. Generalized edema, please write down. Generalized edema, most important sign and symptom. Edema is important. Okay. Then skin becomes shiny. This also you write down. Skin's shiny. Okay. Then the muscles are flabby, not proper toning. Okay. Then most important sign, please write down. Skin will show erythema, red color. Skin will show erythema and there will be pigmented patches. Very important, write down. Pigmented patches on the skin, which sometimes peel off, coming out, peel off, leaving back a raw surface. Leaving back on the skin, raw surface. And this is called as, please write down, very important sign, SIGN, of Kwashiorkor. Very important sign. Please write down. Peeling, P-E-E-L-I-N-G. Peeling, paint sign. P-E-E-L-I-N-G. Peeling, paint sign. Peeling, paint sign. Write down Kwashiorkor. Okay. Then write down about hair. Dictating you hair. Kwashiorkor. Hair becomes red color. Oh my God. Yes, red color. Brittle and lusterless. Red, brittle and lusterless. Write down this thing. Very important signs I am telling you. Okay. And another important sign, abdomen is distended. Abdomen is distended. Are you getting my point? That marasmus child was thin. Can you see? Thin. But this child is looking like this because edema is there. Abdomen is big. But this is a Kwashiorkor. Edema is there. That is not a, weight is not more. Edema is there. He is not fatty. Edema is there. Remember. And protruded abdomen, hair problem is there, skin problem, peeling, paint sign is there. So because of all these things, you can diagnose Kwashiorkor. Okay. Then you have to do blood test. Very simple, very blood test. Blood test. Serum, total protein level will be low. Proteins will be less in the blood. Albumin also will be low. But globulin is high. Albumin low, globulin high. What is the treatment? Treatment, rest in the warm bed or heat cradle. Then diet should give milk. Best is milk. Milk proteins, fish, egg and fruits. Okay. Vitamins and minerals also should be given. And also you have to take care of infections. So my dear friends, this is all about two important diseases about nutritional problem. This is important for your practice, also important for your examination. So I think you have enjoyed this Kaumarbhritya Tantra part A class and also part B class, very of small 15 minutes. Thank you very much once again, and we will see on the Sunday in the morning, 11:15 for the class of Swasthavritta, and in the afternoon 3 to 4 we will discuss Charak Uttarad. Thank you very much. Take care and see you soon.